Hi, I'm Lisa Squire, Senior Communications Advisor with Alberta Health Services, and this is Health Matters. Joining me today is Jennifer Fabian, and Jennifer is a public health nurse with Community Health Services. And today we're going to be talking about flat spots on babies' heads and things that parents and caregivers can do to prevent these. So welcome, Jennifer.
Thank you.
So what are these flat spots? What causes them? Tell us a little bit about that.
Well, a baby's skull bones are quite soft at birth to allow for the safe passing of the head during the birthing process. And those skull bones remain quite soft in the first year of life to help accommodate the rapid brain development that occurs. So we do recommend that babies are placed on their backs to sleep because this is shown to reduce the incidence of SIDS, or sudden infant death syndrome. Now, with babies spending a lot of time sleeping during the day and don't have very much mobility, this can create a lot of pressure to the back of the skull. And that can lead to flat spots developing because of how soft the skull bones remain. So in this picture, it does demonstrate how a flat spot to the back of the skull can result. And this is called brachycephaly, where it's evenly flat on both sides of the back of the skull. Sometimes the baby has a preference as to which side of the head they like to turn their head towards, or sometimes there's a condition called torticollis, where there's restricted muscle movement in the neck, creating more pressure to one side of the baby's skull. And that's what we call plagiocephaly, or positional plagiocephaly. Now, this diagram shows the difference between a regular skull versus one where there's been excess pressure to that right side there, or sorry, that would be the left side. So you can see how the difference in how that head can develop, the shape of the head.
And how do I know if my child is developing a flat spot? Like, what exactly is it that I'm looking for, and how can I treat that?
So at the routine well child clinic appointments, the public health nurse will monitor and assess the shape of the baby's skull. Most oftentimes, mild or moderate cases of plagiocephaly or brachycephaly can be easily treated with repositioning strategies or counterpressure strategies. More severe cases we do result in needing to wear helmets. A referral to a physiotherapist is required for that, and basically there's a helmet that can help reshape the baby's skull. Now, the helmet needs to be worn for 23 hours of the day for 3 to 4 months, and it requires adjustments every 3 to 4 weeks to accommodate the child's growth. So it is quite an intensive process if it does get to that point. The other thing is it's not covered by Alberta Healthcare, and it can cost several hundreds or even thousands of dollars to purchase for that. So it is best if we can treat it right away. The public health nurse at the routine well child clinic appointments will teach parents how to carry out these strategies safely and effectively.
And as you were saying, like, it can be quite extensive in order to correct the problem. So what can parents and caregivers do to try to prevent it altogether?
The number one best thing is, like you say, prevention, absolutely, so that we don't have it getting to that point. So the best thing that parents can do for their babies to avoid this is tummy time, because tummy time can be easily incorporated into a daily routine. It's something that parents should be doing with their children several times throughout the day and every single day, where the baby is not putting any pressure on the back or the sides of the skull. So there's several ways that parents can go about doing this. One way, for example, I have my little doll here, is doing skin to skin with your baby. Anytime you're doing skin to skin, you can hold the baby on your lap. I'm not going to do that so I don't smack the baby's head on the table, but laying the baby on their lap. You can even place the baby on the floor with or without a rolled up towel, just underneath the child's armpits, like so. And that helps to alleviate some of the pressure to the back or sides of the skull. So that's the number one most important thing to do, is tummy time. The other thing is tummy time can help encourage the development of those milestones, such as crawling or rolling. So it is a good strategy for parents to do every day. Another thing that can help prevent these flat spots is by repositioning your child in the crib. So for example, If one night I'm going to lay my baby in the crib this way, the next night I want to turn them around so their head is facing the other way. And the reason we recommend this is oftentimes babies have a favorite spot that they like to look at in their room. So if they're always placed at the same end of the crib, they're always going to be looking in that direction, hence always placing more pressure on one side of the skull. If you are able to reposition your baby with diaper changes in a similar fashion, where with one diaper change I'm going to have the head at this end of the change table, and with the next diaper change I'll have the head at the opposite end of the table. Again, the child's going to be looking at you, the caregiver, as you're changing their diaper. So by alternating their position on the diaper change table, it can also help to even out the amount of pressure that's on the sides of the skull. The last thing is with feeding. Breastfeeding, alternating different breastfeeding positions, and for bottle-fed babies, if you can alternate the hand with which you offer a bottle, it can also help to even out the amount of pressure that's placed on either side of the skull.
Great, thanks, Jennifer. That's some really great information about a topic we don't hear a lot about, so thank you for sharing that. And if you have concerns about flat spots on your child's head, please contact a public health nurse near you. I'm Lisa Squires, and this is Health Matters.